Hi, everybody. We'll get started. Can I get a thumbs up from somebody online to make sure that you can hear me?
I don't see any thumbs ups. Oh, there we go.
Yeah. Okay, great. So we have a number of folks online. I think that became the more popular option with yesterday's snow. But thankful for all of you who are attending either online or in person. So those of you who've been attending this whole series, I'm going to introduce our three very different panelists than you've been seeing so far. And if you haven't been for the whole series, I will make sure that all of you who signed up will send out an email with all of the recorded sessions, because if you missed the first two, which were really law related around how do we get benefits, how do we set up a trust for my child after I'm gone, those types of questions, I'll make sure that you get that so that you have access to that information. But today is a very different topic. Today we're talking about housing, supported housing for the long term. So we have three lovely panelists with us today, and I will introduce them. We'll start with the two executive directors of supported housing facilities. Hannah Schwartz is the executive director of Riverflow Community, which is only a few years old, and got started actually with Jim as part of the starting group. We'll introduce him in just a moment. So Hannah started out forming and co-founding Heartbeat Life Sharing in 2000. For those of you who are familiar with that, she served as their executive director and development director. And she has lifelong experience with social therapy, and she's really committed to bringing the life sharing philosophy to community-based care for adults with developmental disabilities in Vermont. So she is our Vermont representative. Those of you who've been with us now for three sessions know that we've tried to have representatives from Vermont and New Hampshire to make sure that we are covering our entire community here in the Upper Valley. Sylvia, who is to her left, is the founder and executive director for Visions for Creative Housing Solutions here in New Hampshire. And Sylvia and her husband have two daughters with developmental disabilities. And back in 2004, started meeting with other families, all looking for permanent housing solutions and support options for their adult children. So Visions for Creative Housing Solutions was the result, which opened in 2014. Next, we are going to introduce Jim Caffrey. And Jim is the law expert in the room. As you all know, we've been bringing in lawyers to each of our sessions because the law comes into play with everything surrounding disabilities. And so Jim has been in law since '94 and has started his own firm back in 2011. And in 2025, he and his law partner, Caitlin Keating, who you might remember from our previous sessions, formed Caffrey and Keating. He's also part of the Special Needs Alliance since 2007. Again, Caitlin talked about that quite a bit at our last session as well.
And I won't mention it.
You can definitely mention it again. It was a great resource for those of you who might have gone and looked it up. So that is our introductions. Those of you, this is the first time that you're coming, I'm going to tell you just in general how this is going to go. I'm going to ask a question to start. They're going to give their answers. And then as you have questions, go ahead and raise your hand. If you are in the room, you can raise your hand right here. If you are remote, if you don't mind either putting up your hand by the icon or turning on your camera and actually putting your hand up, either of those will work, and we'll call on you guys to ask some questions because they'll answer your questions as well. All right. Thank you very much, Sylvia.
How do I do that?
Just go up to the top.
Yeah.
Top.
No one that says admit.
Yeah.
Okay.
Great. We want everyone to be welcome here, guys. All right. So to our panelists, families often hear that laws and funding streams can conflict. From your perspective, what is the single most important policy or regulation families should understand first?
Who wants to answer first? I can answer. I think it's really important when you have a son or a daughter with a developmental disability that when they turn 18, you need to start thinking about what supports, what funding you can apply for that might even help long-term, even if you're not sure how you're going to use it. But for instance, Social Security, that they can qualify for Social Security, and Medicaid. So Medicaid services, the DD waiver, the developmental disabilities waiver, actually is used to provide supports when they leave the school system. So definitely by 21, you want to make sure that you have Medicaid in place, but start it early. Don't wait till they turn 21. That should be in place actually from birth on. It used to be the Katie Beckett waiver. Now it's just Medicaid for the developmental disabilities waiver.
Vermont still calls it Katie Beckett.
Do they still call it New Hampshire? Doesn't. Or is the TD waiver? They've shortened everything up so that no one understands. So that, I think for some families that is a little bit challenging because sometimes people wait till their son or daughter are 21 or 22 and they're leaving the school systems, the public school systems, and then they're looking for services, but how we pay for services in our country is through Medicaid. So and it's not just the Medicaid health insurance, it's Medicaid very specifically, the developmental disability waiver for kids. So I think that's important to differentiate first.
I would piggyback that just there's a lot to getting the waiver, and I think that's not made clear that there's a lot to that. There's a lot of assessments, and they're very deficit based, and that can be very shocking and also painful to go through to be eligible for that Medicaid waiver. And so just really diving in and knowing, how to get through all of that it's critical to look at what are the steps, what are the requirements, what is specific to your state in order to be eligible for that Medicaid waiver difficulty of care payment.
And I think, since we're talking about housing, I guess the biggest thing to understand is, or at least to start to get a handle on, is what are the options that exist in your state? And Vermont, and Medicaid is federal, but each state has a great deal of autonomy, and even though Connecticut River's not that wide, the systems are pretty different between New Hampshire and Vermont. And frankly, Vermont's a little easier to deal with based on my understanding with some New Hampshire colleagues. Just in terms of Medicaid eligibility in Vermont, if you are eligible for SSI, you are automatically eligible for Medicaid. In New Hampshire is
not so much.
209. But I know how to do it this time. When it comes to housing, I think the main thing to think about is there are really two different. Obviously, they're interrelated, but money for housing is not going to come from Medicaid. What comes from Medicaid is money for support services. And so they're generally, at least in Vermont, historically, they've been completely disconnected, which is why Vermont is in the predicament that it's in now. Understanding what those different funding sources are for services, because I think New Hampshire, you also use the adult foster care model.
Well, no, we don't. We're 100,001 residential setting. So to pay for the housing, to pay for the housing, so it's board and room, that's where Social Security is.
That's where the SSI.
That's right, so Social Security pays for board and room, it cannot pay, well, frankly, it's not enough money to pay for the services.
No, it is not.
Right, but it pays, so at Visions, the only thing that the resident pays is board and room, which is state set, so right now, $848 a month, it includes your apartment, your food, your utilities, everything. Like if you have an apartment or a room, it pays for everything. The Medicaid services is what it is, like the support services.
And so in Visions, are the support services provided by Visions people or from other service agencies?
We do everything.
Okay, so Visions is the Medicaid provider and
We build Medicaid.
built for those support services.
So that's why it's important for families to know it's good to have Social Security and a Medicaid waiver,
Right.
in place.
So in Vermont, Katie Beckett is only is Medicaid for children under age 19. And I think that's one thing. I don't know how the folks in the room or the folks online. Not everyone with a developmental disability is I would say, millions of people have a disability. Only some of them are legally disabled. And so step one is, does the level of disability rise to legal disability for purposes of Social Security and Medicaid? Within, at least in Vermont, within the developmental disabilities program, not everyone who is disabled enough for Social Security is disabled enough for the Vermont waiver. I mean, they're in Vermont, I think we're about half the population, but there are 15,000 people with some manner of intellectual disability. There are only 3,400 that receive anything under the DD waiver, and of that, only about 1,500 that receive 24/7 home schools. So it's understanding what the different programs are and where your family member falls within that. You got to start from there.
There is a hand up.
Great. Hannah, will you be in charge of calling on people from the online, please?
Yes, sounds like Emily.
Hey, my question is just, do you have to have the need, the justified need, and the Medicaid support for the in-home services to be in these housing options? Period.
Yes, there's different roles at Riverflow. I should back up. Hold on. In Riverflow, there are lots of different roles. It is an intentional community, and so there's lots of ways of being part, from volunteering part-time to engaging in many different ways. To receive services at Riverflow, yes, you have to qualify for those two streams.
And housing is considered services?
Correct.
Okay, thank you.
Is that true for Visions as well?
It is. We do have some individuals who privately pay, who do not qualify. So Visions, our model is we support some people who need that intensive 24/7 support. Other individuals are sort of in the middle, and then we have some individuals who are quite independent, but still require our services or benefit from our services. So we do have
Where people could private pay and participate.
right,
Yes.
a minimal charge. So we do have some people applying for full time.
Yeah.
Over their board.
Yeah, I think there's a real goal of looking at inclusion and diversification from the intentional community model perspective, and we're only in our first year, so we're working out all the ways, and right now we have tremendous participation from the local community and people coming in, participating in many different ways.
But in terms of Riverflow start, it was specifically about, started out with one other family, then there were 3 families, now 4. But individuals who are pretty high needs folks, and that may not, well, it sounds like you do have some folks that are,
We have some
and so,
24/7 supports, yeah.
and so that is, you know, eligibility for the housing depends on the level of disability and essentially your level of crisis within a family, and whether or not somebody is going to be eligible for a large enough waiver budget that they could participate in and live at Riverflow.
I mean, our number one goal was to serve folks with significant need that weren't finding placement anywhere.
Any questions from in-person audience? No? Any more from our remote friends? I will move to our next question then. So funding for supported housing and long-term services often comes from multiple sources, each with limits. How can families realistically navigate these options without becoming overwhelmed? Is that the question, guys? Like, it is overwhelming.
Do you mean to start something on their own or finding, so a couple of things. It really depends. I always think we need more choices in our state, both Vermont and New Hampshire. Let's just face it, it's pretty dire. It would be nice to think that you all have for your child a budget that could either serve that individual, your child, either with 24/7 care in their own apartment or wherever they're living, or developing, let's say, a house with 3 roommates and have enough funding, right, pooling those funds in to provide support for 3 individuals living together. Or, so when you talk about funding, yes, you have to have enough funding to be able to pay for the overnight staff, for the day staff, who is going to supervise it, who's going, so think that you're no longer going to be in the picture, right? Someday we hope that our children are going to thrive when we're no longer here. So to think of a model where the parent has to be the person who supervises whatever you develop is wrong. Because it's kind of has become our mantra in our state, especially in New Hampshire, you know, because I think they've sold us a little bit of bill of goods that, you know, parent directed. I think it's great. It can work really well for some people, but for some people it's a little frightening as we get older and think about how do we still supervise our staff, you know, supervise the living situation. Maybe they're sharing a house with 2 other roommates, but the parents are the ones who are setting it up and supervising it. We need to have more choice in both of our states. And I think that's the advocacy work that through SNSC, through parents, through groups, that we need to really work on. I don't know if that really answered that question at all, but you have to have funding to pay for these and then think about who's going to supervise whatever model.
I would say networking together as parents and really utilizing, in Vermont they created DBHI, Elizabeth Campbell started this parent networking, and I think that has been a real game changer for families because they become a resource for each other. I think we need to be creating resource books that can be shared. How do you get a waiver? What are, like in New Hampshire, what are the steps you would take? You know, really simple, easy pamphlets and resources that are extremely easy to find, that you're not digging through the internet and trying to find everything. I just find parents have just said, I'm digging. I'm always searching. But having a resource, a really centralized parent-led resource that you can go to each other and ask how to do things. I think getting organizations like Vision, Riverflow, Heartbeat, different models, we need choice, desperately need choice. We've had no funding for bricks and mortar. Every state needs to realize that they, you know, like we've hand raised, I had to raise up to $14 million to build the infrastructure for Heartbeat. That's like all philanthropy. And yes, now it's a great resource for the state of Vermont, and it's housing many people, but that was, my career. So I think really pushing for what I would call low-income dollars, housing dollars, to get allocated to the field of disability. We have to start doing serious advocacy around housing and funding dollars, government dollars going towards housing, because it hasn't been done, and we don't have the options, which means we don't have authentic choice. We talk about person-centered. People need to be able to go have choices where they live, not placements. It's really important. And if there's only two options, it's hard to call it a choice. So, and sometimes there's no options. So,
Jennifer?
Oh, I didn't know what DHI is, but
So DDHI, just for everyone in the room, is still a completely informal group of parents in Vermont. It's now grown to, I think it's about 170 families, because there has not been a consistent voice for advocacy on behalf of parents, generally super high needs individuals, and there are self-advocacy groups, and they are able to get a lot. They have easier access to grants, and so the DDHI came about when our friend Elizabeth wrote an op-ed in the Vermont Digger, which I think is the New Hampshire Bulletin would be your equivalent of kind of a get in there and mix it up. Is that?
Where is that DDHI domicile?
What's that?
Where are they domiciled?
Basically on the internet. All we have, the only organization is that there's a listserv, but there's no director. It is not a 501c3. It is now just this ever-growing listserv of Vermont families who, from Brattleboro to St. Jay and Bennington to St. Albans, covered. It's just kind of grown organically, so it's not an official group, but they were, and I've been part of that.
What was the best organization to try and go to get assistance? I've been to many. But talking about whether the PBI and 18 months old, I've watched Lee at 10 years old. Lived in New Hampshire where community business involved with services. But they were crazy, and that they're crazy during COVID. Anyway, I decided to bring him to Vermont because he wanted to come to be near family with him. And so I did that. It was a battle for almost 2 or 3 years with the courts in New Hampshire. People were fighting that were involved in that. It was pretty crazy. But anyway, so when I got here, they wanted me, first of all, the court ordered me to get guardianship in Vermont. They ordered me to get these services in place, which you cannot do until he physically living.
Correct.
And that was what I went through. And then I just went through the packet. Then COVID came about, and he ended up having cancer since 2013. And they had another 4th surgery we got to Vermont. I had set him up with all of his doctors and everything. I said, go on, I'm working on this. And just trying to provide you with everything. He's supposed to have services full time. I have gone through Senior Solutions, I went to CRS, I went to all of them, I filled out paperwork 3 times, and I still don't have what I need in place.
I'm going to repeat the questions for our remote guests because they can't hear in the room. So for our remote guests, we have a question about who do we go to when we need help getting services, when we keep filling out application after application, and we can't get to the point of having all the services we need. I'm going to jump in a little bit because maybe someone would answer SNSC. So one thing that we do is we have advocates, we have volunteer advocates who case manage for people, and they themselves aren't the service providers, but they help you to navigate the vast number of service providers there are out there. They can help fill in applications for people. They can help give you advice on where to go. They can help do an introduction between you and someone else. If you are struggling with the organization of all of this, because many parents do, then that case manager can help you with that too. So we do some of that work. Also, if you want to be one of those advocates that does that case management, we're always looking for more. We have about 10 right now. So that's, I'll put that plug out there as well. But any other resources you guys know about?
At New Hampshire Parent Information Center, SNSC, I'm sure Vermont.
So Vermont has the Vermont Family Network, which is, I think it's similar, not the parent information. I think they're called the Vermont Family Network. Unfortunately, the majority of their focus is on the under 21 set, and so their depth of knowledge on adult services and eligibility for services is not as robust as what my wife and I went to them when our son was a little kid about school related. But unfortunately in Vermont there's not the need.
It's very good.
And
they're all spread out in different locations.
And unfortunately Vermont is in the midst of a complete revamping of their developmental services system. And I am being recorded, so it's had some bumps, and it's not going super smoothly. So, unfortunately, for families that are just entering the system or dealing with the system, you should be able to go to an intake coordinator at HCRS.
I actually went so far as to do all of that. The person came and did an evaluation and told me that he did need the services, and then they refused to. So,
I always say, rules of thumb is, you'll be told no 3 times.
that's what it is. Well, he had
Applying for Medicaid, applying for services, and
He had
it's just
medication one time, and then he took away the Medicaid. I wasn't giving any explanation. It's just,
So I do see that we have other people with questions. Do you mind if I grab the person online? Thank you.
Couple online, Julia and
Okay, thank you so much. This is really informative. This is just really quick. If somebody in the audience asks a question, do you think you could repeat it or paraphrase, because it's hard for us to hear?
Yes.
And that's my only question. It's super great to hear all of you. Thank you.
there was another hand up. I did not do that. Well, I guess the hand is down.
Any other questions? Did you have another question? Good. Okay. All right, I'll move on to my next question then. What are the biggest barriers, legal, financial, or policy related, that prevents families from accessing appropriate long-term services? And what are some workarounds that people could try to do?
I think the biggest thing is that when New Hampshire closed Laconia and Vermont closed Brandon, and they promised this community-based system that, and that was around the time that Medicaid dollars could start to be used for community-based programs and not institution-based programs. But the Medicaid only paid for services. Medicaid didn't pay for housing. And so I think the biggest challenge has been that state legislatures have not committed the funding through non-Medicaid avenues to create the housing stock for people with IDD.
I will say the need in New Hampshire. So for myself, I have 2 daughters with developmental disabilities, and I knew that if something happened to me, I didn't know where my children would end up. I was also a home care provider at that time, a special educator, so I started having more and more people start to live with me. So learning the system, learning the, the certification licensing system, I right away knew that we needed to do something as families. But what the challenge was when we started Visions was we were told no so many times, because no, you can't be a congregate setting. People with developmental disabilities can't be together. They shouldn't even be together at a restaurant. And I'm not kidding you, but I was told that by their executive agency. That they shouldn't enjoy, classes together, or really certainly not live together. Two people at the most, they would start to quiver when I would talk about. So what we had to prove was that no matter how, if it's 2 people living together, 5 people living together, Visions, 11 people or 12 people, the focus should be choice, person-centered approach, that they are part of the community, that they have choice where they're going to live, what they're going to do. And we just haven't been fighting enough for that, because the only choice really in New Hampshire, other than a few family groups that have started up, is home care providers, which I think some people do an awesome job. I was a home care provider. But I don't think it's the right model for everyone. For instance, my daughter is nonverbal, my youngest. She's nonverbal, she's medically fragile. I cannot imagine anyone taking care of my child 24/7 hours a day. It just would burn you out. So I think we have to fight against that outlook that people with developmental disabilities don't have the choice to live with where they want to live and who they want to live with. And I think it just is going to take parents, individuals, groups that can make a change in both Vermont and New Hampshire. Because it's the number one thing, right? When they send out questionnaires, right, surveys, what is the number one thing that people are looking for? Housing.
Right.
Supporting. What will happen to my child when I'm no longer here? But it never gets answered. It never. We should have so many choices that Visions, should be like, fighting for services instead of having, 50 people on a wait list or whatever. That to me is a challenge. And there is funding out there. There's low-income housing. Visions is we are a low-income housing nonprofit. We have benefited from using the New Hampshire Housing Finance Authority, Federal Home Loan Bank of Boston. So I think they have seen the need. I know New Hampshire Housing Finance Authority, we were one of the first that was able to benefit. I think Farmstead's too, you have too. They know it's a need. I think they're trying to find some dollars to support housing like us, but it takes, the beings above to say, we want different models. We want choice in our state. And that's where we need to go to.
I think the one thing, and I tell this to clients all the time, when they are told, you must do this, with somebody because you have local nonprofit agencies similar to Vermont that designate so an HCRS equivalent, and people are told, you can't do this, or you must do this. And the overwhelming majority of the time, that's a policy. It's not in a law passed by the legislature. It's not in a regulation that has been through the Administrative Procedures Act. It's because that's the way we've always done it. Guess what? That's not law. And so, I've, every now and again, I'll, arm my clients, like, this is the statute that says you get to look at every bit of documentation in your child's, or brother's, or, if you're the guardian, you have the right to all of this information. And if somebody says you can't do this type, whether regardless of the type of service, but if it's about housing, show me the citation. Show me the law that says I cannot do that. for that. And well, we have this policy memo. Like, yeah, that doesn't mean anything. And so I think that the continued advocacy on behalf of our adult siblings or children is continuing to push for that. And I'll let Hannah speak to this, but River Flow Access was the first organization in Vermont to do the
Barriers.
what is
To do what?
Fight
To
the
act-
barriers.
fight the barriers, but to access other sources of housing funds. I mean, how many different grants did you get that had nothing to do with disabilities?
Yeah, low-income housing. So just, people don't understand no-income housing, and that was the term I came up with. I was like, low-income, and they kept saying, so when will you recover people? And when will they be able to get a job? And when will they not need the unit? And you're trying to like, oh God, we are really on different planets.
Yeah.
Like, we're living different experiences here. And so I truly believe a translation between disability housing for folks that don't fit our capitalistic system and are never gonna. It's not a system that's built with inclusion in mind, I mean, if you have, there's just so many ways for folks living with a neurological difference, living with mental health, living with acute disability of any kind. There's really challenges to our capitalistic working system. And so, we just need to look at how do we get no-income housing? What does that actually look like? And trying to describe that to the low-income housing folks who have really goodwill, and even their applications, it was hard to fill out housing grant applications because they're not written to even be answered by our population. So I think there's a lot of translation ahead of us, but we were successful. We were able to access VHIP housing, Vermont Housing Conservation Board for low-income housing. We're really working to translate what we're doing into disability dollars and recognizing that it's a population that has not elevated itself into the conversation or they haven't been given a platform to share their distinct needs. And Vermont, I call it the Brandon Promise. When they closed Brandon Training Center, they made a promise to the families of Vermont that housing and options would be put on the table. 4 years later, we're still waiting for those options.
It closed in '93.
And I wanted
They
to...
were the first. Laconia was the first state to eliminate this institution.
1991.
19.
Right, it was just a couple of years before Vermont.
It was before.
But I think in terms of, thinking,
Two separate buildings.
what's that?
Went to two separate buildings.
I just wanted to add, one more thing. In terms of the shared living provider model, which in Vermont is adult foster care, that is just the legal form. We're seeing a real crisis in that model. That model has been the providing model, and it's no longer working. So like a dominant model that's was the primary practice for housing. I think the housing crisis, young people can't afford to buy a home, so even if they have the goodwill to do the work, they can't afford a home, and the renovations then that are needed to be a home care provider are unaffordable. So there's no young people coming into the field, and we also have about 350 home care providers that know they're in the last 4 years of doing their services. They're retired, and they're in the same boat that parents have been in, which is that they love that person, they've done a tremendously good job, but they're physically not able. And so now we're going to have an older population of adults with developmental disabilities coming in to needing housing. So we're just really housing and options. It's like, I said it's like standing under a tsunami and pretending it's sunny. Like, we got it. We have a real issue. And, there's times that breaks your heart when you're really frustrated as an advocate and as someone who's cared and been in the field for 26 years. Like, how come and this is not new. All these issues that you're up against, I've been like, yelling.
We've been yelling.
We've been yelling. Like, we're here.
I would love to challenge the three of you. Here's what I've heard. I've heard what we need is advocacy, which is totally true. And I'm going to say that from you, if any of you have advocacy needs or say, hey, here's a time you can advocate, I have everybody's here email address and I will send it out to the whole group and say, here's a chance to advocate. But what I want from you now are practical solutions for people who are not in the space where they are ready to advocate or advocate, but I need a solution now. What are some practical solutions for these folks?
I think, just say this to clients all the time. You should start with what do you or what does your child, what's going to work for them? Start there. Because there will be some folks, my son is also nonverbal, but he's a very quietly social guy. And so so being in a setting with his peers works really well for him and it draws him out and it engages him. So being in that setting, my wife and I knew that's what we wanted. So once we knew what we wanted, then we could figure out how to get there. So the first thing I would say is, what is going to be best for your son or daughter, and if he or she is able, if they're able to articulate that, what do they want? And then you work backwards from there. How do I get there? But figure out where you want to be first. We have some folks that, my son or daughter would never be able to live in a setting with, other people around and where it's going to be noisy and chaotic, and that would be a bad outcome. Okay, so then you're looking to create, and that's where the adult foster care or shared living, that may work great. The problem that often arises in Vermont is if it doesn't work, the individual ends up being moved to somewhere else within the service territory. So, and a lot of it's going to come down to money, and sometimes you won't be able to make it work. But we have folks that are able to create the stability of a house, and then find the caregivers through an area agency that the caregivers will come into the house. And so, I think knowing what outcome you want first, and then working backwards from there as to what are the barriers, legal and financial, and staffing. If you have the ability to, so the support person in Vermont, in the shared living arrangement, they get paid this stipend. Well, if the family's able to, you can live in this 2-bedroom condo with my son, and you're not going to pay any rent. Well, your meager pay just got a lot more palatable if folks are able to do that. And so it's start with what do you want your end result, what are the legal barriers, and unfortunately, what are the financial barriers? Because there won't be public funding for the bricks and mortar of a lot of the outcomes that people want.
I wanted to say, tell me your name.
Gina.
Gina?
Yep.
I just wanted to say, I know that I really heard you say it's really hard, I'm not getting the outcomes I'm looking for, and I'm really trying. And I'm trying everywhere I can. Is that what I
thought I was almost there.
Okay. I just want to say, I don't know, I'm so familiar with Vermont because that's where I'm from. But I really have found that there are good people everywhere.
I'm sure of that.
And so finding that person, I don't know, are you working with an area agency?
No.
So working with an area agency and finding someone really good, and don't settle for someone who doesn't hear you. So that's really important. And a case manager is not, it feels like, oh no, I'm stuck with this person. That's not true. If you feel like they're not doing their job, you can ask for someone else. So like knowing, and that's the advocacy, that's the self-advocacy for you and your family member, is knowing I have the power actually to let someone go. Like if they're not hearing me and not advocating for the person I care for, then they're not doing their job.
I think what I was trying to do with the person was really when she came and she did the assessment, everything was a go, and then it dropped his Medicaid. So then they would see it.
Yeah.
And then I gave her permission to speak with them to find out what was going on and what the problem was. And it still didn't work. And then I was not able to get back to it at that time. It was December, and I worked in the postal service. So, but I'm going to go first for the year and get things going again. Try to do it again.
Just
And I would think
for those of you online, we just had a member of the audience share a struggle she's had with an area agency approving her child and then the child not being approved for Medicaid.
as an adult.
Sorry.
70-year-old.
Yes, an adult child whose Medicaid was taken away, and sharing that story.
Yeah, and the other thing I would say is you can't lose Medicaid. You have to be, you can ask what reason Medicaid was lost, because they do an evaluation, and if the evaluation was done incorrectly with insufficient information, it can look like you lost Medicaid, but it just means like the evaluation itself was incomplete.
The forms are confusing too, because it asked who's showing the house, it asked what the household income was. And I spoke to someone that got TikTok to find out if they could assist me. And I was told that because I was his guardian, and he wasn't eligible for Medicaid. And then I heard through the training before this that it's not true.
The comment was that she was told because she was her brother's guardian that he was not eligible for Medicaid. That is baloney.
Oh,
That is-
that's
That is, wow. Wow.
Yeah,
Who told you? I'm sorry, who told
I
you?
don't know the name of the man.
Well, I didn't, but, yeah,
It was
what,
in the financial services office, right there, just inside the government district. And I asked 2 or 3 people, and they all weren't sure of it, and they went to Dennis, and he said,
so somebody within financial services at Dartmouth Hitchcock is focused on getting Dartmouth Hitchcock paid. They are not going to be-
I was asking for assistance in filling out paperwork to try to make sure I was filling it out correctly, and that's when they told me.
I'm gonna jump in.
Yeah.
We do our case management for free. I'm not trying to sell you a service. Give us a call. We're going to help you fill in the paperwork, talk to the people, make sure they understand that just because you're your brother's guardian, he can still have Medicaid. But we can help you with all this stuff, because everything that you're saying sounds terrible.
She has left since, and the person that's in her place now said, I don't know very much about it at all. I would like to be able to help you, but I can't, because I don't know.
Call Kendra.
Yes. Well, not me myself. We have call SNSC. All right.
Have the right number to call when this is all over.
Yes. So I want to get some more questions. And again, these are questions that have to do with these practical solutions. Go ahead from the audience.
One of the things that, when you're talking about barriers to housing, one of the barriers that I've come across is my son's behavior. It's part of his developmental disability, but it was exacerbated by a home provider situation where the home provider was founded for neglect, and he became very physically upset and would hit and do things like that. And at this point, there is no place for him. He's got the money, but he has absolutely no place to be except in my home. And I'm the one that's been working through the behaviors. At this point, they're trying to get approval for a behaviorist in this program. I don't even know what that means. So I've become the behaviorist in the house and trying to work with him and work him through his default, which had become lashing out. His psychiatrist coined a new phrase and said he has pathological demand avoidance, which I thought was a perfect description, that if you want him to do something and he does not want to do it, when he first came home a year ago, he would have an explosion, a lashing out explosion. And now he will talk about it. It's been a year, and I've gotten him to that point where he will talk about it, but he will tell me when he has reached the threshold of not being able to talk about it.
I'm done talking about it, Mom.
Right, you betcha. So anyway, he's getting better and better, probably weekly, but I'm with him all the time. So I have to step back sometimes and look at it. So my issue is, how do I then, if he does come through the other side of this, how do I get people to accept that he's not lashing out anymore? We have small communities, everybody knows him.
Yeah.
And how do I then get him to have an opportunity to be in supported housing of some sort? And I don't want a home provider again. I can't do that. I have a visceral reaction to that.
I'm going to repeat the question for those online, and then I'll let you guys answer it. So a woman having experience that I think many of you might have had before, where adult child lashing out and lost some supportive housing because of it, living at home. Mom is having to become the behaviorist, which sounds really difficult, but is having positive effects there. When the adult child gets to the point of being able to live in a home without lashing out, how do we find a home that will then accept him with the history that he has?
I would like to take a stab at that.
Yeah.
That is a need, and it's not just you. Just know that so many people need services that are unique to working with behaviors and counselors. I see that all the time, and one of my dreams is to work with West Central in a supported housing model that actually has trained, therapists, counselors, trained staff in a small house with just a few, maybe 3 or 4 individuals. We know that that's a need. And I think West Central recognizes that that's a need. I'm hoping that will happen at some point, but who wants to wait for that? And parents are getting older, and it is frustrating. I know this because there have been individuals who have tried to live in Visions, and for whatever reasons, it's hard to live with 11 people, right? And recognizing that wasn't something that we did really well because our staff are not equipped or trained, and realizing that a small model would work great. I know that it's a need. I am frustrated by the area agencies that somehow that they're waiting for parents to do this, and why aren't they collaborating to get this done?
So as you've piqued my interest, my son's still managed through the school, and when we have changing needs, like he gets regular assessments from the psychiatrist at the school, and documented where he is every 3 years. Is there not an adult analog for that kind of assessment at all?
I'm gonna repeat the question first.
There is an assessment, but
Just repeating the question again. For those of you whose child is not yet an adult and you're still in the school system and you're used to those every 3-year assessments for your IEP, does that not continue after they become an adult?
No, unless you privately pay, or sometimes you could get Medicaid if there is a needed reason.
Yeah, I mean, they do it in a very different way, and in some ways there's, assessments are both wonderful and super harmful. I think they're both. Because I think, because of their deficit focus of trying to dig in, but for someone who has been labeled a behavioral problem, we know that in school systems, we know that in adult life, and moving the conversation to all behavior as information. You know, your son had a traumatic experience, his behavior escalated. That to me is just behavior as information. He's allowing himself in the only way he knows how to express, I'm very angry, I'm very hurt, this didn't work for me. We have like a lot of intellectual capacity to get all into that. When someone doesn't, it comes off in out behavior. We're aware of that, right? So then when that's outgrown, that history in the adult world tends to travel with them. And that's what you're saying. How will someone see my son for who he is with the work he's put behind this historical trauma to move into a place and be welcomed, right?
Yeah, and also, even if he can't be welcomed in the housing that's available, and what Sylvia said was looking at a different kind of housing for this population would be a remarkable thing for John, with a smaller population, with something that's more accessible, because the housing that was offered to him was with non-native English speakers with very thick accents that Jonathan could not understand. Even though it was a lovely placement, those were the only placements that were available were with non-native English speakers. And that's a hard thing, and I'm not trying to be discriminatory, but John has to be able to understand what's happening. So as we move through this process, the options become so narrow that I just thought we really needed to talk about this. Because I know I'm not the only one. I worked at a school. I saw all those kids. And I know that he's not the only one that has gotten to adulthood that needs different type of housing.
The comment from the audience is that when opportunities become so narrow, they become zero. They become non-existent, and just expressing the frustration with that. I wanted to kind of come back a little bit to a question from the audience, really about transition times, which you didn't quite express this question, but I think you're getting there. That transition from the school-based setting, whether it's 18 or 22, into adulthood, and the extreme change in support systems and what that looks like. When thinking about housing, this is a new question that wasn't on my list, sorry guys. When thinking about housing in that age of 18 to 22 and setting that up, any advice for that particular time for families?
I would love to start with that. Yeah. So I actually worked as a transition coordinator for a local school system, and I worked with adults in the school system 18 to 22 transitioning. I will say, it's really important to think about what do you want your son and daughter to know and to do in adulthood, right? So thinking about how are they interacting in the community. School does not have to happen in the school. That's number one. And I fought hard for my own children and for the students I work with. School can happen out in the community. So the best thing to do is thinking about volunteering. Maybe even paid employment. Are there some activities that they might enjoy? What is it like grocery shopping? Budgeting? Whatever their likes, where they want to be, like you said, where do you want to be in 4 or 5 years? And how do I get there? So it might not be, reading is important, math is important, that also can happen in the school day, but then some of the time can happen out in the community. So I really think about, visualize what your son will, hopefully where he'll be when he turns 22 and leaves the school system, and how do you get there? That's really important. Sharing. Maybe it's, how well do you interact with peers? Playing board games, playing games. That sounds like a lot of fun, but actually it teaches a lot of sharing and interacting and socializing. That all is really important too. So I had to fight hard. Also, school does not necessarily happen from 8:30 to 2:30. Did you know that there's nothing written in the laws that says that? That actually school could be, for your child, if he or she needs it, it could be from 8:30 to 5:30. Did you know that? It's a little bit of a fight, but there is no law that says school ends at 2:30. So just so you know, you can certainly ask and advocate using SNSC or a good advocate for if your son or daughter needs additional services, and maybe it is, learning to be out in the community. So I did this with my daughter. My daughter went to school 8 in the morning till 5 at night. The school paid for that. Sometimes it's tiring. The advocacy that we need to do as parents, I will just say, is exhausting. And it unfortunately doesn't even let me turn to it is hard. I'm sure you can add to that about visualizing.
Yeah, I mean, one thing that's just true, and I'm guessing that's not the case for many folks in this room, but there are a lot of students who are eligible for services. The level of need to receive school-based services is lower than the level of need clinically to receive adult services. So there are some folks who they get to 18, or if they graduate at 18, or they stay. That they've got no services when they graduate. So and certainly if you're still in the school years, you want to be starting to talk to SNSC or so.
And that assessment is through SSI approval, and which then kind of ties into Medicaid approval? Is that what you said?
So SSI and Medicaid as health insurance is one set of eligibility for school services requires a level of need here.
Right.
Eligibility for SSI and Medicaid as health insurance is higher.
Yeah.
Eligibility for the DD waiver is higher still.
And so who makes that, so that, sorry, I'm struggling. So if he's coming towards the last few years of school and we apply for SSI, they're going to make that determination.
The federal government through the Social Security Administration is going to make that determination.
By asking for what evaluations? Who's going to be, what is that decision based on?
When you have to apply online for SSI, and when you upload all of those evaluations that you have, it's kind of on you in that context. And in Vermont, actually, the federal government from the Social Security Administration farms out the clinical assessment to the state of Vermont. I don't know if New Hampshire does that as well. So the evaluators for SSI as to clinical eligibility is actually a state program, the Division of Disability Determination Services in Vermont. And you just give them all of the stuff that you have from IEPs, neuropsych evals, any of that stuff. You are going to be giving to the Social Security Administration.
Yes.
My point is just be aware that if there's a determination of, yes, your son, I think, is eligible for SSI. In New Hampshire, you've got to file a separate application for Medicaid.
Not a problem. but good for other people. Yes, no, sorry.
Okay.
But no, that's part of
Are you in Vermont? Okay. So Vermont, it's automatic. You get Medicaid as health
That
insurance.
should be what you said earlier.
But then if you are in need of, or if your son is going to need support services beyond a check for $1,000 in Medicaid as health insurance, you're going to have to go to your designated agency in Vermont. And
apply again for Katie Beckett, right?
Katie Beckett is a children's program.
Oh, great.
But you're going to apply for the DD waiver in Vermont.
Okay.
And again, that whole system has been turned upside down, and you're going to have to go through the process there. But school-based services are determined by the school.
Yep.
SSI eligibility and automatic Medicaid, if you're in Vermont, that's determined by the federal government. And Vermont has 3 different Social Security offices: Burlington, Montpelier, Rutland. So depending on where you are in the state, if you're in the southern part of the state, you'll end up in going to the Rutland office. But it is your local designated agency that should be your first step in adult support services. Non-medical support services are what is funded through the DD waiver.
Do you know what district you're in?
What town? Orange County.
Yeah.
Upper Valley Services.
That's, and Upper Valley's great. They're really great.
I have stayed here on purpose.
Upper Valley is a great agency. They are
Really great.
yeah.
All right, let's take some more
I
questions.
just had a statement. My brother, when he was going through the assessment by a clinician, or person hired to do it, at least we ended up, we did it all. And then she said to me, well, they might deny him because of his treatment and chemo, having 2 rounds of chemo, and they're not saying he has chemo. And that's why he had all these issues. And I went, no, that is not true in any way, shape, or manner. And I said, he's been like this his whole life. And then, fortunately, I had a 20-year-old write-up from a doctor when he was in Concord, New Hampshire, that saved him and spelled out exactly all about him and his developmental disabilities, his epilepsy, and everything is in a complete write-up, and that's what saved him.
So the question was going to almost sounds like it was a threat that about the evaluation, and certainly I don't have time to clean anything in my house, so I'm sure I'm not going to throw at any of my son's old evaluations. But hold on to all of that. Did you really? Did you scan it first? Please tell me. Wow. Okay. Don't do that. So, and one thing is certainly, so if you're in the Upper Valley, Vermont has Vermont Legal Aid. I'm assuming New Hampshire has a similar legal services. In Vermont, there is the legal aid, free legal services on a variety of different issues. They have a poverty law project, they have an elder law project, and they have a disabilities law project. And so throughout the state of Vermont, because I'm in private practice, but I work with some of the legal aid offices, and again, there are a lot of times that people just get jerked around. And so reaching out to somebody in if you're in Bradford, probably either St. Jay or Springfield offices of Vermont Legal Aid. Unfortunately, sometimes all it takes is getting a letter with the signature that's followed by ESQ. And
you can't scare me.
But you can scare
Yes.
the intake agency.
Yeah.
So
Send a letter.
But so, I'm sure New Hampshire has some equivalent of legal aid, and
Disabilities rights.
okay,
It makes a huge difference.
and so that is. Do they have staff attorneys in it? No.
At the time.
Okay.
University definitely does.
VFN, the Vermont Family Network, does not. But anyway, where were we?
Any more questions before I move on to my next question?
No questions, Sean.
Okay.
Here.
So This might be a little bit more for our two executive directors, although, Jim, you have a son in one of the houses, so you could speak to this as well. What does supported housing actually look like in practice? I'd love you to talk both about, first and foremost, maybe about your own organizations and what it looks like, but also what other models are there out there that you've seen and perhaps explored with other people?
Sure. Supported housing. Well, support. The word support is in there. It's not just a house or an apartment or a room. It's support. So that's number one. Because it's great to have low-income housing, but if you're not providing any support with it, it's not going to work, right? So the Visions model, well, man. So 2014 started because I almost lost my life. And I knew I had to be proactive to make sure that my children had a place to live. So my daughter was 38 and 40. My 40-year-old just got married. My 38-year-old has chronic medical conditions, is nonverbal, in a wheelchair. So, and I'm a special educator. So for Visions, we wanted to support some people who needed that 24/7 real intensive care. And then some people like my daughter, Ashley, who just got married in Wisconsin. And then some people maybe who are pretty independent, so everyone, you know. So the support really is, they support each other. It's amazing what happens when people who are living together with different abilities support each other. So there's the word support again. And then support by staff, you know. So we looked at many, many models around New England. And we decided a couple things. We wanted staff to come in fresh because we knew from being parents that this is a lot of work taking care of our kids. And we wanted people to come in who were paid a living wage, who would come in and do it overnight and support individuals in their house, work one-on-one with individuals to make sure that everyone gets up in the morning and has something to do, has a meaningful life, involved in the community. 95% of our residents have paid employment. They also almost all volunteer. They go to great activities through SNSC and just other community. They're very involved in the community. So we also realized that what is the number one fear for a lot of people living with developmental disabilities? It's loneliness. And it's great to have an apartment and maybe even have supported apartment, but making sure that you have activities you can go to, that you have something to do to get up in the morning and go and do something, right? Get out of the house, like all of us do, right? Have a job, volunteer. So, you know, no matter what model you're looking at, but specifically Visions, that was one of ours. I think highlights and something we do really well is supporting people. I think I got a little off track. Yeah. So that's, yeah, so everyone is so unique, and we need to be very person-centered, you know, not everyone, we're not, I always hate it when someone calls us a group home, because I think it's the old, you know, group home where everybody kind of went and did something and did it all together. Having your own life, deciding what you're going to do every day, where you're going to work, who you're going to hang out with, and enjoying every day, having friendships. I mean, that's what we all want. So that's what we created.
I love that. I want to say ditto.
I want to work in the law.
It's funny, you use the word support and I use the word community. I make sense of the world through the word community. I was raised in an intentional community that is called Camp Hill. It's Kimberton Hills, Pennsylvania. My parents were founders. My dad is an attorney, participated when our big institution was shutting, and really watched the deinstitutionalization movement from the eyes of a child. And felt deeply impacted. And I think that's knowing that options were needed started very young, probably around the age of 7. I realized, oh, we need options. And left community, got multiple degrees. I have a master's in special education and a master's in social work, but got a little wonderful experience I got in college, fell in love with Vermont. And I think community just kept coming back, like we need each other. We can't do this alone, and the nuclear family setting didn't make sense for me, having come from an intentional community model. Just like your neighbor gets sick, I had this experience of a neighbor getting sick, and they wouldn't let me continue to do the babysitting because the family couldn't afford to pay me, and the dad felt ashamed of that. And I just had this, I was like, what's happening? We're losing this sense of community and caring for each other. And then folks who need services, when community breaks down, have the highest impact because they need community for the services to work well. You were talking about that experience of friends helping friends, right? That's like, that's the level of community for me. And I also looked at the statistics of quality of care, and families still provide the highest quality of care out there. Like, the happiest, best outcomes are still friends living with their families. So our services are not matching up with that great outcome. So I was like, how do we take the family model and the love and intention that comes in many families and build that into a community? And also got to study and travel literally worldwide, looking at intentional community models, both inclusive and just co-housing models, and took kind of the best of all of that and built Heartbeat, and now I'm working on Riverflow. And that really, I say there is a business element. I always remind everybody, we are running businesses. They have to be done well. We are also a community. The community level is the equalizer. It's the place I love when people come in and say, so who's who? So I was like, well, we're all here together and we're just all people. It's like, that's the beauty of community. We're all felting at the same table. And we do, I love that too. Like, it's so person-centered. People have their private rhythms. I call them private rhythms. And then there are community practices too, like eating our meals together. And, a morning circle where we have a check-in. How's everybody doing? How are we dressed for the weather today? Are we ready for our day? Oh, you had a doctor's appointment. I have a doctor's appointment too. Let's not go in 2 cars. Let's go in 1 car, that morning circle place where everybody gets to check in about their day, see how they're doing. Oh, I got a cold unexpectedly. How are we going to deal with that today? The community element, there's so much beauty in that. That's really our equalizer. And then the freedom is that personal scheduling. Do I have my job? Am I going to speech therapy that's only for me? Is my parent coming to take me away for a week? Oh, I'm coming back and I'm needing to settle in. All those personal, private, individualized schedules that we in and out of that community level. And at Riverflow, we do, the community side is, we love growing our own food. There are things we do together, things we do separately. I really love the arts. I always wonder why they're left out of everything. I'm like, come on, bring the arts back. We have woodworking, and that is so fun to watch. I wish I had a picture for all of you to see the incredible cutting boards. And one person loves animals a lot, Jim's son. And so we've started these cheese boards that are all animals. And he's riveted. If it's a pig, it's going to get sanded. He's like so into it. It's going to stand on his bedside table. So just like really finding what people love and want to be doing and tailoring whatever's coming into the community to that personal interest that then also I watched that love, like Duncan's love for the animals has become such a trend for all of us. So it's like the next cheese board, it's actually shaped like a carrot because one of the friends really wanted to do a carrot. So, but just really fun to watch how personal interest also drives what unfolds. And that's that person-centered lens. If someone loves making tea or scented pillows, we're going to have a patch of lavender, and that's going to get harvested, and they're going to get to see where the lavender comes from, and then get sewn into a pillow that then they give as a gift to their family. And yeah, you get both community and personal interests that match and meet.
I think I'd say, for my son who is for him to be in a place where he is not being forced to move at the pace of the outside world, because he gets dysregulated. Hurry up is a 4-letter word to my boy. And so if he is able to live in an environment where there is enough staff, and I know that you bristle at you're all community members, whether you're providing support or receiving support, but there are enough folks that that Duncan is able to move at his pace, and that helps keep him regulated. And so we don't see, we've seen a few, but where he's not being driven like, okay, we gotta do this, and then we gotta do this, and then we're gonna do that, because that's where the outbursts, we've called them moments for the last 25 years, but where he's not having a moment because he is being supported to move at the pace that works for him. And that's not going to be the same, and that it all goes back to the person-centered. What does the person need? And so if somebody needs to move at a slower pace, is that going to be an option? And at River Flow it is.
And that is the key. So what you just said is very important. We need to have, we're not all alike, right? Our children aren't alike, we're not all alike. We need to have different models so that we have choice and that our children can find a place where they can be successful. That is the beauty of it.
Right.
We need downtown models, we need farming models, we need tiny horse models. We need so many different models right now. I can think of me too. I can open up I think seniors. We don't even think about this. Yes. We could do like a senior model where half the building is, people over 60 or whatever, and then people with developmental disabilities, sharing, and there's so many things that we could do. But it takes the energy, and unfortunately, we're relying on parents to do the work. If I have a wish that the agencies would take a hold of this and say, we're all going to think outside the box, and we're going to think of different supportive housing models that we can provide for our constituents. Wouldn't that be wonderful? That it's going to take all of us yelling and screaming that this is what we need. And because it's not going to change without us asking for it. Visions can't solve it. River Flow can't solve all the issues because there's so many people that need services. And it's heartbreaking. That's what we first talked when we first met each other. It is heartbreaking to get phone calls for people that we cannot serve because either we have a waiting list or, for whatever reason. And it's overwhelming. There is a crisis happening, a tsunami. And I wish we could solve all the issues, but we can't. I think options, just to really know, and also don't be afraid to contact your commissioner. Our commissioner is Jill Bowen, and she is, I know you said Vermont's upside down with this huge transition, and it is, but the hope is that the transition is towards more equity and options. That's the goal. And if we hold that accountable, then hopefully undoing what has been the recognition that the home care provider model has run its course, so to speak, and that there are really good people out there that will continue, and we have to kind of match the conversation with the housing crisis. But really, the Commissioner of Aging and Disability, whoever that is in New Hampshire, knowing that we can write to them, we can advocate to them, and sometimes they're really amazing, good people, and they have a lot of power.
Questions?
How is that battle fought? How does that go? I mean, what's the process in trying to get all that done? They have to go through different agencies or to the Congress here or what have you. That process to get that all in place to try to make it change.
So the question was, how do you take on your commissioner? It wasn't quite a paraphrase.
Or how do we change the housing? How do we increase options? Who do we write to? Where does that conversation go?
And I guess, one question, in New Hampshire, is there a motivated group, a parent-oriented group that has access to?
We don't have the same kind of parent group that you have in Vermont.
We've only had it for 4 years.
There are a lot of groups that have sprung up, parents who have gotten together in areas who have said we need to provide some sort of supported housing. We have a toolkit on our website to share all of our knowledge with how we arrived to where we are. And because one thing that was really frustrating for me when we started Visions is no one would share with us. No one was nonprofit.
Sorry.
Yeah.
I wish we knew each other.
Well, because you were a threat to their model.
I guess. But so when we received funding through New Hampshire Housing Finance Authority, they said, we're surprised that you've got this far. You're a mom. And we want you to be able to share this with anyone else that wants to replicate your model. And not totally replicate, do something different with it too.
Yeah.
So we do have groups in our state that are popping up. Our Place in Dover, New Hampshire, they're in the middle of their capital campaign. Home Possible Project in Laconia. But what makes me sad and a little angry is that it's always parents doing the work. Why, don't you think? Like, I'm retired enough, but why aren't the area agencies, looking to see what great work we have all done and say, boy, I think we can tackle this. We can provide some, we can think outside the box.
So one concrete thing that I would recommend in New Hampshire, which came about through this parent-led organization in Vermont, is and the position's now vacant and they need to hurry up. But we were able to convince the legislature that the Developmental Disability Services Division needed someone whose full-time job was DD housing. Looking at models from elsewhere in the country, and how could we apply that here? And so, again, it was, because that's what Vermont legislatures do, we'll allocate whatever, it was $100,000 for 3 years, and now that has to be renewed, and the person that was there left. But through advocacy, which your capital conquered, through advocacy at the legislature, and talking to your disabilities commissioner, can you find somebody whose job it is to explore what those different options are and what's going to work. And then the area agencies get their funding through the state agency. And so if the state agency is saying, we have this housing specialist, you need to start providing that. And I would say that that's a pretty concrete, is somebody who is a state employee whose job it is to investigate and learn the pros and cons of different housing models. Because a housing situation that's going to be right for somebody with some explosive behavior is going to be different than it is for somebody who is in a wheelchair and needs a Hoyer lift that needs all of these things. They're not, it is not going to be one size fits all. And so if there's somebody whose job it is to look at what is out there and what is being done, I think that's a concrete thing that it was a big deal in Vermont to get that. And I'm pretty sure that it'll be reauthorized.
When was that set up? 3 years ago?
The legislation was passed in 22. It's called Act 186, and it did two things. One, it created this position, and two, when state government was flush with COVID ARPA money, they allocated $500,000 for pilot planning projects, and river flow was one of the grant winners. It wasn't a huge amount of money, but it was it's better than a sharp stick in the eye, and it helped get the ball rolling. With started out with a couple of families, and then hallelujah, we convinced Anthony to come on board, and but so there was the pilot planning aspect of it, but then also the creation of this developmental disabilities residential. The name was too long, but it was a DD housing dedicated person, and that was their only job, was to work on different models that were sustainable. So,
Questions? Anyone from online? I see a hand.
Yes, there's a hand.
Emmett.
Hello, Hannah, Sylvia, and I missed your name.
Jim.
Jim, hi Jim. It's Helen, Emmett, and Aaron Norton. We know Sylvia very well. Hannah, we met you many years ago at Heartbeat. I want to say several things. First of all, this is a wonderful, we are learning a lot of things, even though we've been working on this a long time. I think something all parents really need to be aware of, and probably many are, the importance of networking. The importance of, even if your child isn't a fit for some model or another, is connecting. So today, Aaron went to Zach's place in Woodstock. We're very fortunate to have that enrichment center. And Caitlin and Susanna led us through a felting activity. Susanna lives at Heartbeat. Caitlin has moved and now lives in the Woodstock community. I have Aaron's box of felting. We didn't finish, we were late to the game today. But having that connection, and when Susanna walked up to Aaron, and Aaron's been in scenes over a while, Aaron reached out and I almost was in tears, gave her this huge hug. Erin's in a wheelchair. She's one of these 24/7 people that are really kind of hard to fit into a model. But the importance of networking and advocacy never goes away. We always will be in that mode. Emmett's youngest brother is in supported living in New York in a situation been in for 20 years, and he's at almost 70. And Emmett attends his life planning meetings. Emmett's mother, who died at 97, was still advocating for her son at that age. So that never goes away. And the parents, as parents, we do have, I think, to realize there are other people who can support our family members, maybe even better than we can. We actually built a house for our daughter. We have the roof over her head, because Vermont's a very different place, but now we're kind of looking at the next steps because of our age. Erin has some friends, or one friend for sure, at Riverflow that she attends camp with, and I'm anxious to hear a lot more about it. But I think that the importance of network and connecting with other families, which Sylvia, you have always been a very strong advocate of, is so important, whether they're in New Hampshire or Vermont. We can learn a lot from each other. And I just want to thank the Special Needs Support Center for doing this whole series. I do know there is a work that has just been done, I've been getting it through this DDHI group on Act 69, which I'm not familiar with, I haven't read that act yet. It's encouraging for those of us in Vermont. That's, I guess, something that all of us will be learning more about. But thank you for doing this. It's great to see you know it.
So, Act 69 was additional legislation that was passed in 25, or in the 25 legislative session, and it required that there be a legislative summer study committee, which oftentimes you'll hear people say summer study committees are where good ideas go to die. But the final report has come out. I attended every one of those Act 69 meetings. And so I can make that available to Kendra so that you can put a link on your site to the housing report that came out as a result of that. And the best part about that was that the legislation required that there be 2 legislators. And so there was a state senator from Windsor County, and then there was a member from the House of Representatives from Washington County, and they learned a whole lot by being involved in this committee, and forgetting their names, but now.
Joe Major? Was Joe Major the one from Windsor County?
No.
He is a senator from Windsor County.
Charlie Kimball. Was it Charlie Kimball?
No.
Allison Larson.
That's the one. And
she's from Woodstock.
Woodstock, okay. Which is Windsor County, right? Okay. But Senator Clarkson was great. Representative Donahue was great. And by being on this committee, I think they gained a level of understanding that they did not have in June. And so they were awesome. So I will send to you the Act 69 related stuff and the report that has come out. And they are now calling for, will it happen? Who the heck knows? But they're looking at asking the legislature for, I think, $5 million a year for the next 10 years or something like that, where dedicated to creating housing opportunities for folks with IDD. And again, all of this came about because of this relentless parent advocacy, and so the folks at the legislature are listening and don't mind.
We have a list of people who send postcards.
Sure.
So what I'll do, let's talk about resources for just a second. What I'll do is any resources that these guys send me, I will send out to everybody who signed up by email, whether they're here or not. So if someone you know signed up and they're like, I wasn't there, will I get the list? Yes, it will come out when we send this video out. And so everyone, even if they're not here, will get that video as well. So it'll be about 3 to 5 days. It takes a little bit for us to process that video. So we'll get all those resources out. I also want to just point out that we have some resources over here. We have pamphlets you can take home from Visions. We have some things we can look through from Riverflow. I'm going to do a bit of a little plug for those of you who don't know SNSC. We do have programs, and they're free. So if you have someone that you're a guardian of who is an adult with disabilities, we do things that you'd see a lot of the Vision folks there, whether it's Art Lab, which is actually something Sylvia started with SNSC a while ago. We have music classes, we have cooking classes. You could, if you have someone in your life who needs to learn how to cook and needs to have that kind of spelled out and helped, we have those classes. We have a volunteer skills teaching class. So we go into a nonprofit and they're taught the skills they need to volunteer at a nonprofit. And then they are given the opportunity to become a volunteer there. So it's self-paced like that. We also do social events. We have dances. Our prom every year is really, really exciting, and lots of people show up and dress up big time for prom. So anyway, check us out if you're interested. You can get our website over the table. It's also, of course, on the handout you got. Those of you who are at home, this handout was sent out in an email. You guys can, if you're in person, you can pick it up here. And I'd be remiss if I didn't say, we planned this for 6 to 9 months, Jim, because you were in the original planning. It's been a long time that we've been planning this 3-part series. Obviously, we wanted to give it to all of you because it's helpful information for the community. If anyone would like to give back to us, we also have our donation information on the table. Thank you. So my final question to all of you guys is, with the limited time we have tonight, what's one key insight or piece of advice you would want every family here to leave with?
Just one?
If you want to do a couple, you could.
Okay. You get more bees with honey than vinegar. So,
Who taught you that?
my wife. So as frustrating as it can be, dealing with somebody at an agency, at a school, stay calm, stay polite, and ask for a citation for the legal basis of what they're telling you you gotta do or you can't do. Show me where it's written. I hear what you're saying, now show me. So I guess those 2 things. Be nice, ask for a citation. I'm done.
I mean, I was raised in Camp Hill, and if you have never heard of Camp Hill, CAMPHILL, Camp Hill Communities, it's really worth exploring. They are the force and inspiration to me understanding the world and community, and they have been advocating in the world of disability since they started in 1940s, late 40s.
There was one in New Hampshire.
No,
Lucas. No, it's not in Camp Hill.
yeah.
Isn't Pioneer?
No,
Oh,
there's Camp Hill inspired communities all over, and then there's Camp Hill communities. They're all really collaborative, but there's a lot to learn from them. I think the communal practices, there's a lot to learn from. The inclusive element, there's a lot to learn from. And like you said, there's no one model, but it's a model that has helped me make sense of the kind of inclusion where somebody can be truly themselves and totally autonomous. Like just watching someone who, in our world, have the space to be totally independent and walk to their friend's house for dinner. And the space between 2 houses. Feeling safe to walk from one house to another house that's almost a mile away and have that alone time. And I've just heard from I worked with for wide variety of need. I also worked for Mansfield Hall, which is an incredible program in Burlington that's folks that are college capable and college curious, 46 kids living in a dorm, going to the different colleges in the Burlington area, accessing higher learning. And so, but just the wish to have autonomy and alone time. And when you have a lot of need for support, that can be not seen as your human right. So I think in Camp Hill, one of the things I really admire is just that people flow through their lives and have a lot of time to be autonomous. And how do we create environments where that's possible? And really also the right to risk. I always say, don't forget, people have the right to take risks. Well, it's I think in the top 5 quality of life factors.
If you have the right to fail.
Yes.
I've been with her for the journey for her mother all these years, so I understand. But I don't know if I'm supposed to say, but I'm also DSOP had visions, and that's such a wonderful place, and it just everything you just said is kind of what we do here, you know, which Sylvia has brought into this is amazing. So I just wanted to say that. Thank you, Sylvia.
And I would say, first of all, my heart breaks because there is such a need and so much is put on parents, but don't give up. You're going to hear no a lot, don't accept no. I always would say I hear no 3 times, whether it's applying for Medicaid, whether it's applying for Social Security, whether it's finding the place where you think your son or daughter will thrive in. Keep trying, keep connections, really important. But don't give up and find a time in your life, focus on that when maybe you don't have to be the sole provider for your son or daughter. And I hope that for all of you, because that's really important too. You know, as a human being, we have a right at some point to be quiet and have to be able to sleep at night. I remember when my children, when we started Visions, and David and I built a little house because our philosophy is, you know, staff come in, no one lives there but the residents, it's their home. And we built a little, like, tiny, small house. And the first night that we sat together and had dinner, it was so weird because our 2 daughters were with us. We didn't have to get, you know, a respite provider to come in to go, like, out on a date. And we were just, it was weird. But
Wonderfully weird.
Wonderfully weird. But I wish that for all of you, you all have the right to do that and have that in your lives. And don't give up.
That's beautiful. What all of that reminds me of is the word belonging. That everybody has the right to belong in their community. Belonging can be like this amorphous idea of like, what is really belonging? So to put it in concrete terms, like, okay, access means everybody could get in this building, right? We came in the building, you know, there's a wheelchair entrance, you know, people can get in here, or this meeting even, you didn't even have to come to the building, right? You could get online, right? You had access. Inclusion is kind of the next step to that. That's what we talk about a lot is inclusion means like you're kind of greeted and said, come on in, we want you here, you know, come join, you're welcomed and you come in and are included. And that's fantastic, and that's where so many people are working towards. But what I heard a vision of tonight was past that. I heard belonging, which is this space was created with you and your children or your brother in mind. That's what belonging is. It's not just that you're included, but you are thought about in the actual planning of it. And so anyway, I just wanted to reflect that back of what I'm hearing tonight. And that's what we're doing. We're trying to create a community in the Upper Valley where everyone can belong. Or in New Hampshire and Vermont where everybody can belong. Are there any last questions from the audience, whether you're in person or remote?
I just have to say thank you.
Yes.
Thank you.
I don't have a question, but I just wanted to say that just because my son does not live in one of the supported communities does not mean that he is not a member of the community. And that he is out almost every single day, Saturdays and Sundays included. He has had a volunteer job for 18 years at Kendall, and when nobody else was available to take him, my husband and I would take him to that. He worked at TJ Maxx for 15 years that they count, but he was there 2 years before that, but they were not counting because he was job training. That stopped when he was with the home provider, and they just stopped taking it. And he not only had the aggression, but he also had gotten very sick there, so he was unable to work. But he's back in the community. He's going to his job at Kendall. He is making lists for the things that he needs and going out to the local community to get those things. He goes to Sparks activities every Friday. He's in art lab. So he has been out in this community, and it is his community, and he sees his friends. And it is very important to him, even though he can't live in that kind of a supported situation. He is very much greeted by everybody that he knows in the community, and it's wonderful.
So for those of you online, we have a lovely comment about the really recognizing the different types of communities, and someone can live in a supported housing and be part of a community, and they can live in at home or different kind of housing, and they're all part of the community, and they're part of the wider community as well as part of the disability community, and I think both communities are important. Great. Any other comments or questions? No. Thank you all for coming tonight. Thank you.